In the meantime, there is this, a political prescription from thousands of doctors who are posting a note in their waiting rooms around the country now, warning patients that Democrats who say they will try to, quote, fix the unpopular health care law if they are reelected are engaged in a political ruse. That letter reads in part, quote, please remember when you vote this November that unless the Democratic Party receives a strong negative message about this power grab, our healthcare system will never be fixed and the doctor-patient relationship will be ruined forever. Dr. Hal Scherz is the president of Docs4PatientCare, the group that put out that letter. Doctor, you say the group has at least around 3,000 doctors in it. And I want to ask you, because your group, you say that you are nonpartisan, but that sounds like a partisan message.
Well, Megan, it would sound like a partisan message, except that that's all we have right now. I take care of Republicans, I take care of Democrats, but what this really is about is the ability for doctors to take care of patients and for doctors and patients to remain in control of healthcare decision making. And right now, what we've got with Obamacare is not really a system where doctors are going to be able to be in control of healthcare decision making. Once this gets fully implemented, it will be the Secretary of Health and Human Services that determines the protocols that I and my colleagues are able to participate, are able to follow through with if we want to participate in the health care insurance exchanges, which is what every single American is going to be compelled to be part of if they're not receiving government health care from Medicare or Medicaid.
You know,
I
just want a couple questions I want to get through with you. You say that the reason, one of the chief reasons you're doing this is because you believe that this is literally a life and death matter for millions of Americans. Really? I mean, is that hyperbole, doctor? How is it a life or death matter?
Well, I think that we know from the British healthcare system, for example, that patients are not receiving their health care in a timely fashion.
The doc can't talk right now. You have to call him back. Keep going, Dr. Scherz.
I'm on call. I'm sorry.
That's all right.
The patients in England sometimes have to wait months, if not years, for their treatments, and that will happen here, especially with the person who is in charge now of Medicare and Medicaid services, Donald Berwick, who's in love with the British healthcare system and who escaped the scrutiny of the Senate, but was a recess appointment by President Obama.
Now,
is it?
So you do.
Is it hyperbole to? Is it hyperbole to think that once we have a system where the government is deciding on what treatments are going to be acceptable and which ones are not, is that life and death? Is it life and death when they're able to withhold cancer-saving drugs, for example, because they're too expensive? I think it is life and death.
Is there pushback? Do you expect pushback from the American Medical Association, the AMA, because they came out after a Florida urologist placed a sign outside of his office making it clear that he didn't want people who voted for President Obama? They came out and said the following. You wrote an op-ed about this. They said, physicians may wonder whether it's appropriate to express political views to patients or their families. And they said physicians should conduct political communications with sensitivity to patients' vulnerability and desire for privacy. You viewed that as a warning from the AMA that you better keep your mouth shut when it comes to political positions on this health care law. Do you expect a similar pushback now? Because you've got a few thousand doctors with you on this.
Well, I think we have 3,500 doctors right now in Docs4PatientCare who are putting this in their offices. And we're reaching out to patients across the country through various outlets to get their doctors to post this letter if they don't have it in their offices already. And will we get pushback from doctors? Of course we will. There are doctors who are on the left side of this issue, and there are doctors on the right and in the middle. And what this really comes down to is ideology. Who should be in charge of healthcare decisions? Should it be the government or should it be doctors and patients? And that's what this is all about. And so what we're doing is simply giving patients an opportunity to learn more about healthcare, because they're not getting this on mainstream media or in mainstream news outlets. And so I think that doctors who are dialed in, who are informed, who know what's coming down the road, have an obligation to their patients to share that information with them.
And your real beef is, I mean, obviously this has already become law, but your real beef is with the candidates who claim, put me back in office because I promise I'm going to fix the law that you don't like, public. Trust me, I'll take care of it. You say it's going to be cosmetic fixes and people shouldn't listen to those candidates.
Absolutely. You know, we've learned through this whole entire escapade that Democrats who voted against this bill are going to try to get political cover, but ultimately they're going to vote with their leadership. Who voted for the bill are going to try to get political cover and say that they are against Obamacare, and they're going to fix what is wrong with it because they recognize that there are problems with this Obamacare bill. But when they get back to Washington, they're just going to vote again with Nancy Pelosi and with Steny Hoyer and all of the other left-sided Democrats in their party who are going to pressure them to vote one way. And so this will never get fixed.
I got to ask you quickly, what's been the patient reaction so far?
Overwhelmingly in favor of this letter. I get emails every single day thanking me for doing this. I get letters from doctors as well. Now, I get letters from doctors on the other side of the issue who think that government-run health care is the way to go because they're angry with the way things are right now with insurance companies. And I'll be the first to admit that that's a big problem that needs to be fixed. But government-run health care is not the answer.
Understood. Dr. Scherz is a pediatric urological surgeon at Georgia Urology and Children's Healthcare of Atlanta. He's also on the faculty of Emory University Medical School. And somebody at one of those institutions is trying to reach you, Doctor. We will let you go tend to your patients. Thanks for coming on.